Hello, everybody. My name is Scott Patton. I'm a professor here in the Department of Community Health Sciences, and it's my pleasure today to introduce a very special guest speaker, Dr. Suresh Tiwari. Dr. Tiwari is a country director with Oxford Policy Management and internationally very much an acclaimed expert in health systems and health system governance. I learned today he has 4 master's degrees in addition to his PhD in that topic. But I think what's most special about Dr. Tiwari's background is the diversity of activities that he's been involved with, especially internationally through organizations such as the Gates Foundation and the Clinton Foundation and many more. He's been a special advisor to the Prime Minister and the government of Nepal, and has been acknowledged by the President for his contributions there to the COVID pandemic. And just a few other notes. I've been spending a couple days with him, so I've been learning a lot, and the breadth of his activities are quite amazing. For example, he's one of the people behind International Mud Day, which some of you may have heard of, some of you not, but this is an effort to get kids away from screens and get out into the real world and get dirty. And also, he makes a trek every year, a 12-day trek with a 6-kilometer height gain to the Everest base camp, which he tells me he plans to do every year until he's 70. Knowing him, he might do it till he's 75 or 80. So I don't want to cut into his time, but before we begin, I would like to take this opportunity to acknowledge the traditional and present day territories of the Blackfoot and people of the Treaty 7 region in southern Alberta, which includes the Siksika, Pikuni, and Kainai, as well as the Tsuut'ina First Nations, and also the Stoney Nakoda First Nations, including Chiniki, Bears Paw, and Wesley First Nations. And also to acknowledge that the University of Calgary is located on the home of Métis Nation of Alberta Region 3. So without further ado, here is Dr. Tiwari.
Thank you, Professor Patton. So it's a thrilling introduction, and yeah, thank you for well wish so that I can go up to 80 trekking. So your blessing will be with me. Thank you for that. And yeah, I'm quite privileged to be here today after 15 years of my education in University of Calgary as a postdoc fellow, able to be here standing and sharing what have we learned and how the problem-based learning has really equipped us in Nepal and country like Nepal in solving the evolving health issues and problems. So before moving into the presentation, let me acknowledge the great contribution of First Nation and the Métis who made this proud land. My deepest respect to them. Sorry. Thank you. A little bit about, we are trying to discuss what the developing world has experienced from the pandemic, and what were the lessons, and still what are the lessons coming in this world, and then sharing as the policy advisor to the government of countries like Nepal, what we had experienced through in terms of in terms of knowing the science, translating science into the evidence, and evidence into the policy, and policy into the resource, so that the healthcare delivery system was resourced by human resource financing and other material resources, and also open the discussion in terms of how we don't want next pandemics and next problems, but if any, let's discuss. I think time has come to continuous discussion how if any pandemics in the future can be prevented. So this is not a presentation of one research finding. Today, I am sharing the synthesis of multiple research works, the rapid assessment, rapid findings, the scientific forum debate discussions, the combination of national understanding, those, putting all those documents, the evidence together, I'm presenting here. So this is a little bit messy slide, which I didn't want to, but I wanted to put in one slide, that's why. So what we learn, I think to me, person like me, I learned is heal thyself and preventing future pandemic is the message. Don't wait days, hours, days, months to get the knowledge, to get the finances, to get the resources, to get the fly-in consultants to solve your problems. Heal thyself, know the problem. You are near, there are the saying that if you are nearby the problems, then the solution also are nearby you. You don't need to travel miles to find the solutions. So that's the message as the advisor to government of Nepal, containing COVID-19. That's the powerful message I got. And if effective political leadership, at least listen to the scientists, value the healthcare professionals, value the importance of leveraging resources, and responsiveness, regional forums. For example, our part of the world, we call South Asia Regional Cooperation. We were striving for the meetings, priority for that nations, but it didn't work like that. And they never sat together and talk about the regional pandemic prevention strategy. So why we need this kind of forum? Because health was not the core business of those regional forums. And we have in Africa, we have in Asia, those reasons. I think time has come to, sound clearly and loudly that those regional forums should prioritize the health issues, health problems, and the most urgent need of pandemic prevention and control. So then, other message that we learn is the whole of the government. Like in terms of, I gave you an example of dead body management. Health workers were working day and night, overcrowded, and they had no time to manage the dead body. That's why we need outside the health system to manage the dead body. We need, for example, in Nepal, support from Nepal Army using the dead body management. So who work under what was always the issue there. How to bring all those government entity into one umbrella so that the command system or the decision-making system work in one flow and the decision happens in a timely manner. And the whole of the societies, societies we created, society that are there in the name of people. They were how to work, how they work across for different agenda. So as community mobilization, so as the compliance of the public health measures. So I think the big learning is we need to first mobilize the government, whole of the government and the whole of the society, sitting in one, creating the dialogue, deliberation, and decision had to be there. And the timely case management strategy had to be there. Not all doctors, internal medicine should know everything. They are not the God. Nurses, they have their life, not 24 hours with the space jet type of PPE, their life. So that's why case management strategy that we learn is don't wait until our beloved World Health Organization produce for you. Prepare for you as a nation, because we all are trained. Like I told you today, I got the education from UFC saying problem-based learning. That's enough. The context, the frame you have, and we got to make our hands dirty to solve the problems. Not all the time professors and universities and international agencies are there. So we are there to solve the problem. And the capacity for data, for decision-making, how to generate the data, streamlining the data, looking after the quality of data, knowing the importance of data and making the right decision. And also, a very important message that we got is we had no other option of continuing the healthcare services, other basic health services. Like it can be very regressive health system if we have stopped in the name of COVID 2 years, if we had stopped the immunization. Think about the regressive impact in the healthcare delivery system and population outcomes. So we had to continue that. And the other message that we got in developing world is shock responsive health system. It's not only pandemic is shock there. In developing world, for example, in Bangladesh and Nepal, flooding is a daily life of people there. It overwhelmed the healthcare delivery system. We don't know when is it. Earthquake is there. Hurricanes are there. So these disaster can overwhelm healthcare delivery system anytime. So let's be prepared. And the procurement on public financial management, I like to say PPFM here, always it has the logic of taxpayer money to be spent in a wise way. What is wise? If that wise promoting the death in the country, we don't need that wise word. Let's take out from the dictionary. We need to save the life first. So make our procurement and financial management system and make our accountants, financial management expert, and Ministry of Finance to really hear health system need. And it may affect not only the healthcare professional, but also entire country and internationally. That's the message. And health workforce, adequate, use, and motivate. Important part is to motivate. So COVID was not only the issue of healthcare professionals. They were never trained and they were never recruited to, address or provide the treatment of COVID-19, but they were there on the ground of, humanitarian ground and the skill ground. So effective communication, infocracy, like information not to be disseminated by some of the countries, said wouldn't really unveil the number of positive cases, severe cases, mild, moderate cases. Not. So that is infocracy, how to deal with infocracy. The bordering country like Nepal, there is an open border between India and China, giant country. If infocracy implemented there and information not passed to the bordering country, it will be a disaster in the future. And the infodemic, like telling that if you gargle by the water, and there won't be any virus. Drink more warm water was the issue in Nepal. And if you drink more warm water, virus wouldn't be able to kill you. So that's infodemic. And we need to really understand and survive with it. And public health, I think it's pronounced the importance of public health is not like outbreak happens and you recruit the people and they are the people to solve all the problems. So public health has to be daily life of healthcare delivery system, and this should be there. There are many pandemics, mental health. If it's way of understanding the health issue caused by the alcohol, cigarettes, and the junk foods, creating huge problem, road traffic accidents. So public health is like, it has to be the daily life, daily work of the healthcare delivery system. Often like country like Nepal, resource poor countries, public health is considered as not a priority one discipline there. So culture of repurposing and redistributing. So like many countries, many international agencies were finding the word how to reallocate the resources that I have for this task to save the life of people. So I think COVID had taught us preventing death, assuring the quality life of the people is important. So that's the main motto of having, taxpayers' money and putting into the right basket. And then vaccine deployment and vaccine nationalism. So I'm, let me be open here that some of the countries have used their Supreme Court to give the verdict that don't sell the vaccine or distribute the vaccine unless you inoculate to your citizenship. So these are the leeway to violate the mandate of international health regulation, IHR, that we all country introduced in 2005 and amended in 2007. So then final and important thing is financing health system. So it has been ever important. And initially you may recall that during early 2000, we were talking about maybe 10% of the national budget. Then we talk about the 5% of GDP. Then now we are talking about the per capita spending in health. But we also need to know what is it. Then we stop talking about the investment. What? If we able to tell the policymaker, politician, this is the resource we need in health system, maybe they come up with more serious decision around the health system financing. So that's the summary of the various international literatures in developing world I have gone through. And then here I would like to slowly drive to the case of Nepal. And before moving into the Nepal, so I would like to remind you to 1948 definition of WHO, physical, mental, and social well-being. Is it left to right or right to left? Social, mental, and physical well-being. Is it 1948 is still carrying with our hopes, problems of today, 2022? Maybe time has come to rethink about our definition. Maybe 1948 definition of WHO is very good. We had a lot of gain we achieved with that constitution, with that charter. Maybe we need to discuss about improving, strengthening it. And then COVID taught us health system has to be able, given the authority to make the decision, health system to be agile, and whatever decision health systems and the healthcare provider gives is accepted by the people, by the politician. So that's the thing I would like to, and let me go to next. And before only, I thought maybe only talking about COVID of Nepal may not be sufficient. That's why I quickly run through. Nepal has done fantastic job in terms of reducing maternal mortality ratio from 539 to 239 in the year 16. So we just have one report of Nepal Demographic and Health Survey. Maybe we expect this to be further down. So that tells why I want to show this is health system. This is considered as a strong, better health system indicator. So Nepalese health system is expanding and getting better. And here the skill birth attendant by the skill hands increasing from 1996, I remember 8% to now national average 60% plus, which is good. And child mortality gradually under 5 and neonatal deaths are reducing over the time. And the those good example I have given to you, but look at the society getting complex, and the suicide rate is increasing. Road traffic accidents are increasing. So other health issues are coming up. So then how we finance? If we look at those 15 years of financing health system, it's not like consistent, as I told you. Initially early 2000, we said 10% of national budget to be allocated in health system. Then we stopped. Maybe that's not the right narrative. We said, okay, let's be flexible, try to get more. What is that more means? If you look at this graph over the 15 years in Nepal, we never reached to 10%. And this is the COVID year, 8.08 was there. We're quite happy, but that happiness didn't sustain long. The next consecutive fiscal year, Nepal has reduced the budget in health sector. It is the example. I think it's similar case, many other developing world having same situation. Without resources, we are not. And you are hearing maybe here in Calgary and developed world, what is the contribution of external development partners to the health sector in the country like Nepal? So even if, yes, same story as government of Nepal during COVID, they have repurposed some international development aid gone up, and 2021-22 fiscal year, they have also reduced. And these are, points to be noted, these 54% is the loan, not a grant. The majority of that proportion is a loan to the country. So we are taking loan to provide the basic service. That is a big question. And are we, country like Nepal, should get the loan in order to provide the healthcare service? It's a big question to us. And epidemiology, yeah, just to tell you that the 2020 January, we have started, raising our red flag, and still raising that red flag, daily reporting, case reporting happening. And it's not, initially they said we are a mountainous country, the virus cannot travel to mountain. Yes, it did travel all over Nepal and expose among the young population, inequity happen in terms of death to the older population. Despite less exposed, more of them been, passed away. And what have we done? So coordination, planning, and financing. So that's initially we said that, okay, Nepal's experience is activate what we have. If the situation is complex, start with something simple. Don't try to create new thing. Activate whatever we have. Then the price regulation, we knew that, okay, COVID can be controlled if you have antibiotics at home, amoxicillin. So we immediately drained the amoxicillin across the country because people will run away to the pharmacies and buy the amoxicillin. So this is patient infodemic induced demand cause huge problem to other service to be continued. So that's and an institutionalization of the learning was also that we have created the institution at the national level, provincial level, and the local level. Right after releasing COVID, there are tendency of some of the political political level. Oh, okay, we had COVID. That's why funding to those institutions significantly reduced. So we are advocating not to do that. Surveillance, I talked a lot. So from very beginning, we have developed two simple pager data system that are the primary healthcare center and the district from all level of health system can capture and report consolidated at the national level, and provided back to the people, even deaths, high, medium, the new cases through the Viber, Facebook, those social media have been actively used, and Ministry of Health every day have been providing the COVID update to the people. So that's, I think we use epidemiological investigation we did, epi-modeling we have done. So I led the process of, conducting the epi-modeling and giving the numbers to the government so that resource can be allocated. And risk communication, yes, a lot of issues, a lot of experts were there. And then I used to visit many those hub and satellite hospital we created, and everybody coming out from the hospital, even the visitor used to tell me that, oh, okay, if you have the medicinal plant, doctor, no COVID will be there. I had 2 glasses of their juice in the morning, I'm fine. I may not need to use the mask. So that level of information and unregulated information was there. Yes, point of entry, I briefly touched upon. Nepal is border to India and China. We had a very difficult time to really control point of entries and regulate testing, monitor the testing was the issue. And never in the history of Nepal's laboratory science, never been prioritized. Diagnostic is prioritized after the COVID. The diagnostic network is now available across the country. Before was very limited, only public sector dominance in, and government of Nepal also opened the private diagnostic centers so that the COVID can be tested. Now other diseases can be tested in those laboratories. So, and the infection prevention and control will a lot learn. COVID had given a lot of message to the importance of having well ventilation, use of the right chemical to disinfect the hospitals, so that the system have been developed. And community engagement, we said case investigation, contact tracing, isolation and quarantine services, well defined. Now policy, guideline, protocols been developed, people well trained, and it's being kept in the stock. And the case management, clinical operations, and the therapeutics also quickly developed over the time, and we have developed our own. Then we came from, we learned from the India, China, Canada, US, UK. That was the learning attitude was quite successful, because we established one small group of scientists, and we named it Knowledge Cafe. So we used to run morning and evening knowledge cafe. Like if I learn from North American infectious disease control groups giving some knowledge, we go and talk in national scientists. These are the messages coming, how we take that message to the policy, how we implement to case management, clinical operations, and therapeutics. So that was really, that knowledge cafe was very, very useful tool that we developed in Nepal. Operational support and logistics supply chain was there. And right after the COVID, we said, okay, we really want to distribute the required supplies, medicine equally by provinces, because if, golden rules are there in the politics always. If you are a prime minister, for example, and you are from province A has potential larger, better opportunity to get more. So that's how we knowing this, immediately after the COVID, we formed the logistic group, inviting the scientists, healthcare professionals, and the international agency, support agency, form that logistic group responsible in getting and distributing in the right way. So it's really worked well. And then finally, the important thing that we shouldn't be forgetting is maintaining essential health services. So we, in Nepal, we identified the hub and satellite hospital, and we identified certain hospitals untouched from the COVID, so that they were there providing immunization, maternal, child, and all those essential healthcare services going. And maintaining, same as I explained, that yes, it did affect. And our learning was if we allow heart hospital to provide, engage in COVID containment, COVID case management, it's not going to be effective. Immediately after we realizing that, make them heart hospital and encourage private hospital to come down and give them reimbursement, the case management money to them based on the mild, moderate, and severe cases. Then we brought private sector and it did really work. And then we could continue those basic health, essential health services at the primary care level and certain identified the tertiary hospital. And this way, Nepal, we never experienced the overcrowded, overwhelmed COVID cases. Vaccination, yes, we had a primary healthcare of Nepal known as the best because our vaccine immunization coverage always go average 90% above, and we have 18 small country, but population wise it's similar to we have 30 million and Canada has around 37, 38 million. Population wise similar, the country's geography is massive. Canada is massive country, but here with this is small country, we have 18,000 around vaccination centers, so that those vaccine initiation in Nepal could be, so we had a smooth implementation of vaccination. We had no major issue, no major issue of the expiry and the loss, damage. And the research and informed decision-making was like as I started initially, we have identified the Nepal Health Research Council as the research hub to get the money, to ask the scientists to submit their research proposal in the priority area identified by Health Research Council. And a lot of young and mid-career scientists were up there providing a lot of information, going into the different areas of research and presenting to the scientific forum that I told you, Knowledge Cafe, and Knowledge Cafe to filter and give it to Government of Nepal, Ministry of Health to make the right decision. So way forward, I think I'm too excited because after 15 years of my standing here and at Calgary, and way forward is nationalism doesn't guarantee a pandemic-free world. That's, I was pretty much actively engaged in 2.5 years of pandemic prevention, not only limiting in Nepal, but also in the region, talking to various scientific committee of the India, Bangladesh, Pakistan, Thailand, and those part of the world. So yes, for the big message is nationalism, using the Supreme Court, High Court, to violate the international health regulation. Let's not do that in the future. One world, one worry would be the formula for the future pandemic solution, preventing. And then we have international, regional, national, and local networks. Let's activate them. Regional dialogues and accountability, developing SOC responsive basic service delivery systems. What we've forgotten is we developed the first strategy to be vaccine to be provided to the health worker, which is well and good, right? But what we forgot to those people giving milk to us, cleaning the hospitals, so they are quite active and going, and they are interacting. As a result, cities of Nepal the SARS has been bad because we didn't know that. So immediately after knowing that, we have prioritized them as a frontline worker. So that's how those basic service, when the pandemic, not only health service, we need to be, because health system cannot run in the absence of basic system. So health worker also need to have those basic service in order to go and provide the service. So that's the lesson. And the improving public health functions and functionary, strengthen the capacity of international institutions here. We have developed many international institutions and were they really effective, timely, and of quality to pass the messages? And our hospital doctors were, oh, we got the clear clinical protocol so that I am confident to provide the right treatment, case management. So that was the question. And we need to keep discussing developing capacity of our international institutions, because taxpayers' money has been flooding towards those international agencies. Hope is to make the better public, better health outcomes was our intention. So then the coordination, cooperation, coexistence, and the compliance. These 4C I really found as powerful C's to really fight against the pandemic. And health in all policy, we talked a lot, many books, many articles, many classrooms were filled with the importance of health in all policies, but how? Where are the institutions to deliver health in all policies? There are, in the absence of, for example, even in developed world, can the health service department and education department talk together in an enough way? Maybe answer is mixed, not yes, right? So I think health policy now need to be discussed in a practical way rather than more theoretical way. And resourcing public health would be the final thing that I can talk about. And thank you for listening me. I should stop here. Thank you all. So now,
I think what will happen now, there's quite a few people online. They may put questions into the chat. Can you start with that?
Put a note in the chat saying.
so anybody would like to shout out, or, is that the right terminology? Okay.
Yeah, thank you very much for your presentation. I think it's a lot of the core messaging is what we in public health have been saying for a long time, and now it's into the forefront. Really, I was really interested in how Nepal and the teams have worked to overcome some of those cross-border international relationships. I wondered if you could speak a little bit about that, if that's not too politically charged, or and just lessons learned that you're taking forward in those international relations.
So the question here is very, I should say it's very important question for a country like Nepal. How have you guys managed to improve the coordination in cross-border since Nepal has open border with the, our India and China? So then what were your strategy? Did it work? And what's the message out of it? So thank you. And yes, a lot of we have the point of entry. So we in country, we identified major the point of entry we defined with India and with China, basically, and the international airport itself, the major immigration we have in Kathmandu. So international immigration through the airport, airplane. So that's the two type. One is inland, as second is by air point of entry. By air point of entry was straightforward. We had established the health desk there with the trained human resource, measuring the fever, if fever, that level of, solutions were there. Quarantine, we initially apply the 15 days quarantine, though we have talked about 21 days and then 15 days, then gradually gone down to 7 days. So that's the year. And it did work well. There's a very good cooperation from the people who flew from abroad to Nepal, and they did testing at the origin. And if in fever, we had identified the hotels where they could go and can stay. On the open border, that was the, we had two discussion in India and China authority. So whoever come into Nepal, so the responsibility of point of entry section, health decks, we used to say, health decks to take the fever and the test. Initially, we start testing the COVID kit. And in any positive diagnosis appear, they should go back to India since it is open border. So if no positive, they are allowed to go and travel. So this is how we like the cross-border committees were there, India and Nepal. Every day they used to discuss initially, then every week they discuss in any evolving issues. So mainly many Nepalis used to go to the go for the seasonal work in India. We had some experience of like not effective testing in other part. And but when they are coming back, we used to find them as a positive and what to do. As a Nepali citizen, Indian citizen, they go back to India. Nepali citizen, we used to take them to the quarantine in hospital nearby, and they test again. And later on, be open if it is more than 7 days and their family willing to care them, allowed to go home after 7 days of those. So overall, in the practice, we had no big issue because the country imposed the lockdowns, both sides. So lockdown really helped healthcare professional not being too much onto the work, the issues. And since lockdown was effective, the police and the security forces in both sides were very much active. That helped, I should say. And now it's being open, and we have learned from both sides. And the vaccine, like vaccine initial hiccups were there in terms of getting vaccine from the cross-border, but now there is no issue. And so initially we had issue of getting vaccine from, because India and China both produced the vaccine. And as a neighboring country, we wanted to be first country to get the distribution from them. But initially we had issue, but later on we got the donation from both China and India. That was the good side. Overall, I see it did work, but the message out of it is to understand and try to communicate your problem well by both countries. And the lesson is like big countries wanted to hear the small countries. Okay, here are our problem, please solve the problem. And they always try to say, okay, these are the problems of our countries, Nepal, can you help us solving? I think that's not happening. And the future pandemic, the message is, yes, let's be upfront, proactive, and talk to the neighbors. That should be a way forward. Thank you.
Actually, we have a couple questions from online, and one of them, they asked, can you expand on the vaccine access this year? Which one were you able to access and when?
Okay. Thank you. This is initially first we developed the vaccine deployment plan. And as I quickly said in my presentation also, Nepal used to get the World Bank IFC loan in health sector. So we've been diplomatically right to tell the World Bank that, okay, repurpose this money to buy the vaccine, Pfizer and Moderna, initially Johnson & Johnson, and then Moderna, then to Pfizer. So we engage one end, the loan coming from World Bank to be repurposed and go directly to the Pfizer, Moderna, and Johnson & Johnson. So that initially we have done. It had around 9-10 months to fix that, but it did work, and it gone before any other countries in South Asia, I should say, before that, because we deal that repurposing thing early hand. Then we received the vaccine from both China and India as donation. They procure, and for that we have this vaccine advisory committee has been formed. Vaccine technical committee has been formed because we knew that we may take the phase 3 trial vaccine in the country, how to take them. Yeah, so that's how we have this drug, drug division is there, health service division is there, and then the two technical and advisory committee are there now active. And we made them active to discuss all the side effect, potential impact, pricing, inoculation, like the cold chain capacity, all to be assessed by them. So as a result, we have received the vaccine from India first, then China. Then we gradually started from getting from J&J we received, Moderna we received, later on we received the AstraZeneca. Covishield was the first vaccine that we received in Nepal, developed by the AstraZeneca. In India, Serum Institute, India government has given that in a donation form. Later on, we have started procuring the vaccine. So these are the ways. And if you ask me now there is no vaccine shortage in Nepal, and more than 70% coverage is there. Thank you.
Another question around One Health.
Oh.
What about One Health? Now we have an AIDS epidemic going on right now.
Where is it?
The health concept is
Mm-hmm.
combining veterinary and physical health,
Mm-hmm.
recognizing that they're linked. Do you have any comment?
Yeah. So I think thank you. This One Health concept is in the one I mentioned about Knowledge Cafe. We have been discussing seriously the importance of bringing the life into the debate. So as a result, One Health policy in Nepal has been endorsed by the cabinet, government of Nepal. The sitting question for us is that sufficient? So do we need to integrate this One Health policy with the national health policy? So I think it has to be, One Health policy has to be part of the national health policy. The national health policy is one policy, and then you have the One Health policy. That means that maybe this One Health policy taken as extra policy, not really seriously accepted by the government in terms of getting more human resource to discuss about it, more veterinary scientists in the laboratory of government of Nepal, more scientists in the disease control divisions. That is not happening, I should say. It's poorly happening. But since policy has endorsed, maybe next job for us, country like Nepal, when we have update, we get the chance to update the current health policy to integrate the One Health policy onto it, so that we can get the resource, we can get the institution, and we get the people to work around that. Thank you.
And maybe just one, we're actually almost out of time, but you talked about the term you used was epidemic, is the term around here, or disinformation. But a lot of that here is centered around social media and anti-vaccine disinformation. Something you didn't mention, I was wondering if vaccine-related disinformation.
Thank you, Professor Patton. Yes, Nepal, I should say Nepal, we had a lot of questions rejections and a lot of misinformation around the side effect of the vaccine and the use of the calf blood. As a result, Hindu religion shouldn't be taking those hardline Hindus shouldn't be taking the calf blood. That is, considered as the serious matter. And we have faced some of the Facebook and then other social media messaging there. We had to come up and we had to tell through different media. And myself personally had gone to independent media and explained why it is safe for human being, how it's safe for you, how it's safe for the community and Nepal itself. So we had to work a little bit around clearing those mess coming from the disinformation. And we coined it in Nepal as infodemic, epidemic to infodemic. So we filter that as infodemic, and still that some level of rejection we found among the hardcore people, but that rejection level is, less than 0 point something. And then so we should say the acceptance is quite good in Nepal.
Thank you very much. That was fascinating to hear about the experience. As there are no more questions, let me just pass on. There's a number of thank yous coming through the chat from the people that weren't here in person. But let us just say thank you maybe one final time, and we'll end our seminar today. So thank you for attending, everybody. And thank you, Dr. Tiwari, for the time and effort and the long travel to make this presentation today.